There is a place like no place on earth. A land full of wonder, mystery, and danger.
We must pass healthcare reform.
Their strategy has been obstruct, to stop, to block.
The Republicans want you to die quickly if you get sick.
What we know about the health care bill is people don't want it to pass.
The Obama administration and my colleagues in Congress are going to continue on their march to shove this government-run health care plan down the throats of the American people.
Well, there you have it. As the House prepares to move towards some kind of vote on health care reform, maybe as soon as this weekend, critics are, well, best I can describe it, freaking out. There's an example from Fox News. The Congress is a scary, scary place. Is history in the making? Are some people afraid of that? If history is in the making, just what kind of history? To help us think about this at this point in the game, we've brought on our resident historian, well, kind of, Stephanie Miller, host of The Stephanie Miller Show. Stephanie, welcome to GRITtv. Glad to have you.
It better say historian underneath
it
me
better,
right now.
Right?
It's just better.
I mean, really, can we get any lower than this? Thank God we're going to vote. Somebody's going to vote soon, because this has got to stop.
Yeah, well, as the show's historian, Laura, I love the whole, we're rushing this. We're right. It's too fast. Roosevelt is probably spinning in his grave because it's happening too fast.
It's happening too fast, but it could possibly happen this weekend, you think, really?
I think so. I mean, I think Dennis Kucinich today was the tipping point, don't you?
Well, let's talk about that. I mean, there was a presidential trip to Ohio this week, and Dennis Kucinich was along for the ride in Air Force One. A lot of people thought, well, maybe this is the president's effort to buy off Kucinich's resistance to the plan. He was resistant because it doesn't have the public option. Looks like it worked.
He's a small man, Laura, and I understand the president tossed him in a contest in a bar in Ohio, and you know, whatever. It's the Lyndon Johnson way of bringing someone around.
Yeah, but you're laughing and I'm kind of chuckling. But it's a little sad what's happened to the public option, isn't it? You were a supporter. You were, and I are both, like Kucinich, actually single-payer supporters.
Right, right. I know. I mean, absolutely. But I saw Sherrod Brown. I think it was on TV the other night, and I think that there are many people, and we've heard this over and over again, that look, civil rights, Social Security, all of these things had to be strengthened over time, and that there are a lot of good people like Sherrod Brown, like the Dennis Kuciniches, that I really do think will keep fighting for that. And, you know, Sherrod Brown, I think, was saying if it's a year, if it's a few months, if it's 5 years, we are going to keep fighting for this. So, you know, there is a lot of good in the bill, and I think that we just have to build on it. So, and there's a lot of pesky terms in the comment you just made in the hands of Glenn Beck, anyway. Take a look at what Glenn Beck had to say about a comment by a young man, an 11-year-old, Marcellus Owens, who spoke to Senate Democrats this week about his mom, who died of, I think, pulmonary failure when she lost health insurance because she lost her job. Pesky phrases, said Beck. Take a look.
There are pesky phrases in that one that we should point out. Social justice, shared community, and collective responsibility. And let's not forget, truly democratic society. Well, we're not a democratic society.
Did that come as news to you, Stephanie?
Laura, why do you hate me so much? Do you subject all of your guests to Glenn Beck clips, or is it just me?
It was special for you.
Yeah. It seems to me that all Jesus ever talked about was social justice. I'm not sure. I don't think he ever asked a leper for a copay, in my opinion. So I don't. Here's the thing on any Glenn Beck point. He's crazy, Laura. He's crazy. So it doesn't make any sense.
This week was interesting because the Beckites didn't come out, or the Beckians, I'm not sure, for their Tea Party lobby day. Everybody I spoke to in Washington said traffic seemed to be moving as usual. You could even get through the halls of Congress all right.
It was a smattering. It was Michelle Bachmann and a bullhorn, which I think is a good idea because then you can hear her say really stupid things really loud.
It's the web has been helping us to do that, in addition to bullhorns.
And did you see Louis Gohmert, the Republican from Texas? This is the pro-sanctity of life party. He was waving the bill around saying, I want to show you an abortion. This is an abortion. He's sort of the carrot top of the fringe right now. He does prop humor.
You confuse me with the top and the fringe. Anyway.
Yeah.
quickly, two relatively serious points. One, that we've seen some serious spats breaking out on the internet. Marcos from Daily Kos, Jane Hampshire from Fire Dog Lake, really at odds about, in fact, what Dennis Kucinich should do in this vote. Some people, like our friends over at BuzzFlash, said, stop quarreling, kids.
Yeah, please stop fighting. You're all pretty. It is, that's something that has, I'm sure, you've dealt with too, that when I'm on the radio, we get these liberals that, we were saying that this happened during the primary. If I don't get my candidate, I'm voting for Nader. Like, I think that we are a big tent party. Mm-hmm. We're the actual big tent party. But as someone that used to go to get out of Iraq rallies and have to deal with hemp people, sometimes the tent might be a little bit too big. I was like, hemp people, let's focus. We're trying to get out of a war here.
You're going to get email now. Maybe I am.
I'm just saying, but I think that
isn't there something positive maybe that comes of all this debate? I mean, if this is a compromise bill, and we've had to give up a lot of what we progressives in and outside of the Democratic Party actually wanted, isn't there the requirement then that the conversation continue rather than be silenced? I mean, it seems kind of healthy to me.
Yes, and I agree with people that said we should have started from single payer. I mean, I do think, and I hope we don't make the same mistake on financial reform, that we spend a year negotiating with Republicans and we're still not going to get one vote. They're going to try to do the same thing to financial reform. They're going to try to keep weakening it, weakening it, weakening it. They're on the side of the banks, and they are on the side of the insurance companies, and they are not going to help us with anything.
So in the weeks to come, do you just move on? You move on to financial regulation debates? Or how do we keep this healthcare debate moving? Well, most of the media, at least, are going to start talking about other things.
Yeah, I don't know about you. I've lost the will to live talking about healthcare myself a little bit, but I do think that there are people like we talked about, like Sherrod Brown or Dennis Kucinich, that will keep working, that feel just as passionately as you and I do about the public option, and I think will keep working. I mean, I don't have a crystal ball to tell you when or how or whatever, but I think it's encouraging that we're already at 40, whatever we're at, 41 senators that want the public option.
Do you have a favorite healthcare story yourself? The president finally heard the word and started telling his mother's story again and telling the story of people who have lost their healthcare because they lost their jobs. I think that's what's put the poll numbers back up for the bill. Well, you have a favorite tale?
I think the story of Natoma that he told, I think this is what we were saying a year ago. You have to put a human face on this because we all have somebody. My mother has breast cancer. She's in the donut hole. She had to wait to get her hormone pills. And, everybody, or Natoma's story, like everyone has a story like that. And that's, I think, what we needed to do is put that human face on it because we've all either dealt with that story ourselves with a loved one or with an insurance company.
Here's the president talking in Strongsville, Ohio.
Now, the reason Natoma's not here today is that she's lying in a hospital bed. She's racked with worry not only about her illness, but about the cost of the tests and the treatment that she's surely going to need to beat it. So you want to know why I'm here, Ohio? I'm here because of Natoma. I'm here because of the countless others who've been forced to face the most terrifying challenges in their lives with the added burden of medical bills they can't pay. I don't think that's right. Neither do you. That's why we need health insurance right now. Health insurance reform right now.
Stephanie Miller, one of the great storytellers. The president's apparently listening. Thanks for coming on the show.
I think that's where he got it from, the Stephanie Miller Show.
More at our website, GRITtv.org.